The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Thanks for joining us, folks. This is the Predictive Health Clinic. And joining me today is Dr. Thomas Seyfried, who, when folks ask me about my favorite interviews on Dr. Philip Ovadia's show, Stay Off My Operating Table, I always include Dr. Seyfried in my top three. Thomas Seyfried, welcome.
Oh, thank you very much, Jack. It's a pleasure to be here today.
As you know, we just kind of have a very tightly scripted show. So the first thing is, what one specific health issue do you want to address?
I'm qualified to address the cancer issue.
All right. I know since that's in the top three killers of Americans in the United States, I think there's going to be plenty of folks who are interested in. First of all, why did you get interested in researching cancer?
It wasn't a plan ever to do that. You know, my early studies at Illinois State University were in neurospora crassa genetics, which is a bread mold. At that time, it was a tool for understanding mutagenesis and these kinds of things. You learn experimental systems as you go through your experience in the field of biology. And then I wrote a nice paper on that, the effects of ethyl methane sulfonate and beta propiolactone on mutagenesis under oxygen and nitrogen conditions in neurospora crassa.
Awesome.
Yeah, really.
English for us?
You know, and my mentor at that time, Herman Brockman, was a classical geneticist who really had a foundational depth of knowledge of genetics. And I really learned so much from him, not only in doing research, but also in the field of genetics. And then I went to the University of Illinois, where we rolled it over into mammalian genetics, and we were working on lipid storage diseases. But I switched a little bit to the lipids that actually store, which are gangliosides and other glycolipids. So I worked at the University of Illinois for my PhD in mammalian genetics. Nothing with cancer, no cancer at all. And then at Yale, I did a real deep dive into glycolipid biochemistry with the late Dr. Robert Yu. I was there for 9 years.
Glycolipid biochemistry, that's sugars and fats.
Yes. And the molecules that I studied for 40 years are called gangliosides. And these are a type of glycolipid that's enriched in the brain. And, you know, there's Tay-Sachs disease, Sonhoff disease, and there's various kinds of diseases that involve defects in the way those molecules are metabolized. And these little kids die from the storage of the gangliosides in their brain due to inherited enzyme deficiencies in hexosaminidase or beta-galactosidase, depending upon what the enzyme is. They're called lysosomal storage diseases, a big area of human genetics on that. But, you know, I was asking more questions about what the hell do these molecules do? We know when you can't break them down, they cause all these different diseases, but what are they there for in the first place?
The glycolipids?
Yeah, the gangliosides in particular, because we know glycolipids are in the myelin sheath, and I did a lot of work on myelin. And of course, you have multiple.
And that's the sheath around nerves.
Yes, the white matter. They call it the white matter of the brain. It's white myelin loaded with cerebrosides. So I did a lot of work on myelin with Dr. Yu, but mostly gangliosides. I was doing developmental biology. We were trying to figure out what these and everybody had this, you know, these speculations about how important they are. And we've got big grants and we did a lot of work. But while I was at Yale, we had some models of brain cancer that I developed there because my mentor, Dr. Yu, had done some work on gangliosides in brain tumors. You know, I got some models. So we were trying to look at gangliosides in brain tumors as well as gangliosides in the developing brain of mice, just to ask questions about, you know, what are these, when do they come? They change in patterns, they do all kinds of stuff. But the issue is I learned brute force biochemistry, traditional hard-ass biochemistry, how you isolate and purify molecules from brain tissue and in absolute pure form. And then we would break these structures down and characterize the structures, characterize the distribution of all this. At the same time, I was running a big mammalian genetics program on epilepsy, and we were trying to map epileptic genes for mice with epilepsy. So I was looking at gangliosides and epileptic brains and brain tumors. So it was a big hodgepodge of programs together. And then when I took the job at Boston College, I brought up all of my mouse models of epilepsy, mouse models of brain cancer, all these models, and we set it up here at Boston College. And then I brought in a whole bunch of graduate students and postdocs, and we just fired it off. The epilepsy, we were mapping genes for epileptic seizures. We were looking at gangliosides in epilepsy. We were doing all this kind of stuff. And publishing really top quality papers in the best journals of the field. Got a lot of recognition. Of course, in a field that nobody knows anything about. You go on the street and say, hey, you know what a ganglioside? I never heard of it. So here I am spending all my time on something that almost nobody on the planet knows about. But you meet the people in the field. There was a lot of guys from Japan and Germany and Italy that worked on these things. So you had an opportunity to meet all kinds of nice people from around the world. But during our work with epilepsy, it was very interesting. One of my grad students came to me and said, there's a meeting on ketogenic diets in Seattle by Jim Abrams, the movie guy who made airplane movies, the airplane movies.
Yeah.
Those Naked Gun and Airplane and those kinds of things. His son, Charlie, had intractable epilepsy and was near death. And he put Charlie on the ketogenic diet, and Charlie got better. And his friend Meryl Streep made a movie, First Do No Harm, which was the story of a child with epilepsy who was recommended to have brain surgery and pills and everything. But he went to Johns Hopkins. Jim took his son Charlie to Johns Hopkins, where there was the only place left where they did work on ketogenic diets. And they saved Charlie's life. So when my student Mariana came to me and said, oh, they're having a big meeting in Seattle to talk about ketogenic diets, she said, can I go? And I said, no, nobody cares about ketogenic diet. I wrote up a grant at Yale because I thought in my epileptic mice, this was when I was at Yale in probably 1980, 1981, somewhere in there. I said, oh, this ketogenic diet sounds good. I'd like to try it on my models of epilepsy. So I wrote an in-house grant to the neurology and medical school at Yale University, and I got shut down from the internal group. They said, nobody cares about ketogenic diets. Here I am in one of the world-class departments of neurology at Yale University, and they're not interested in ketogenic diets. So don't waste your time. So I said, okay. And then all of a sudden, here I'm at Boston College in 1996, and my student, 1995, somewhere 96, and says, oh man, this ketogenic diet is hot stuff. I said, no, nobody cares about it. Only because they told me at Yale, nobody cared about it.
Right.
So anyway, she went out there and she got her own grant. Actually, they gave her a travel stipend, and she came back super excited about this ketogenic diet stuff. And I said, oh, well, we might as well start looking at that. But at the same time, I got a grant for angiogenesis, which is the vascularization of tumors, which was kind of interesting. The tumors are, at that time, people thought cancer could be managed by controlling the vessels in the tumor. And this led to the explosion of anti-angiogenic drugs. All turned out to be a bust anyway. But the whole, in the pharmaceutical field, they just chase stuff and invest in stuff. They don't have any functional brains. So I look at these guys, all they do is just chase stuff. Maybe you can make a lot of money. So at that time, it was around the year 1999, 2000, somewhere in that area. They were, oh man, this angiogenesis. Judah Volkman down here at Harvard, Mass General, found that if you block blood vessels, you could stop tumor growth and all this kind of stuff. We knew that gangliosides played a role in angiogenic properties. So I got a nice grant. Let's look at gangliosides and angiogenesis. I'm really excited about angiogenesis. And what we found out was that calorie restriction could reduce angiogenesis, reduce the tumor, reduce everything, reduce inflammation. But why did we do calorie restriction? Because at the same time, we had a big parallel grant, a study on the epilepsy and ketogenic diets. And what was interesting is the ketogenic diet works best if it's restricted. So blood sugar goes down and ketones go up and the seizures become managed.
Right.
We found out that even just eating regular high carbohydrate diets and putting a mouse into a water-only fast, you get the same results as a ketogenic diet. Blood sugar goes down, ketones go up. It was kind of interesting. So we were trying to figure out how ketogenic diets and calorie restriction work on epilepsy. But at the same time, we were looking at angiogenesis. And then we got a drug. Some guy, one of our anti-ganglioside drugs, and butyldeoxynogermicin, don't worry about it, MBDNJ. It was a drug. It was a drug that blocked ganglioside biosynthesis. We thought that would be very interesting in a variety of ways. We got the drug and I put it on some mice that had brain tumors because the drug blocked epileptic seizures and shrunk brain tumors. Can you believe this drug? So I told the pharmaceutical guy. In fact, the company that gave me the drug, some of my colleagues from England they heard that we got preliminary results at Boston College that their little drug that blocks ganglioside biosynthesis also stopped epileptic seizures and shrunk brain tumors. So a big company, I can't remember the name of it now, gave me over $200,000. They just, how much money do you want? And I said, oh, $200,000, that's plenty. So why don't you figure out the mechanism by which this drug is working? Because we can make millions and millions of dollars. We have a drug that can stop seizures and brain cancer. I said, oh my God, they got so excited. Everybody was going wild. So we were feeding the mice with epilepsy and the seizures were stopping. And the mice, we were given the drug. We take the powder food, and we put the drug in the powdered food, and the mice would eat the powdered food. And the other group got powdered lab chow with no drug, and the experimentals got the powdered food with the drug. And they were both eating, but I was noticing that the body weight of the guys getting the drug was much lower than the body weight of the guys not getting the drug. And that we saw that in the epilepsy as well. Wow, the body weight is going down. The mice seem to be eating. And then I said, what's going on with this drug? So it turned out that the drug blocked the ability of the mouse to digest the food. So the animal
was starving to death.
Even though it was eating. That was the amazing thing. So he was eating and eating. And we said there, how much food? Yeah, he looks like he's always in the bowl, trying to get the food. But his body weight was going down. So we didn't know at the time what was going on because we didn't cut the mouse open. We just wanted to know what was going on with the tumors. But the tumors were shrinking because you could actually measure the size and see the size of the tumor shrinking. So what I said to the students, I said, okay, we're going to put another group of mice into the study. So we have the guys getting powder with no food, with no drug, powder with drug, and they're losing body weight. So we just took another group of mice who give them powder, but we gave them only the powder that would match the body weight of the drug group. So that we had a body weight control matched. And lo and behold, the tumor shrunk to the same level as the drug group.
Without the drug.
Yeah, without the drug. And it became, so I measured the blood glucose, and even the guys eating the food had low blood sugar. So the problem was, we opened the mouse up and we found the digestive tract all full of undigested food. And it turned out the drug blocked sucrases in the stomach. So the animals couldn't get any energy out of the food they were eating.
Oh my God.
Yeah. And not only that, the drug actually stopped ganglioside biosynthesis. It actually did what it was supposed to do. But that wasn't the reason why the drug was shrinking tumors and stopping epilepsy. It was because you were calorie restricting the animals they were eating, but they couldn't digest the food.
Wow.
So we published this paper, and they told me, I published the paper in 2001, and they were livid when I told them we're putting the mechanism as calorie restriction, nothing to do with specialized ganglions.
So much for making money on that.
Yeah, so much for the support immediately dried up. No more support for you. We learned so much from that study that got us into the power of calorie restriction and water-only fasting in stopping tumor growth and all of the mechanisms by which it started. We started to, and then we said that in a conscious decision back then, We said, nobody wants, what you talk, as soon as you're in a crowd of people, they're all eating stuff and drinking and having a good time. And you walk in, okay, everybody's got to drink water now for the next 3 weeks. Yeah, nobody wants to hear that,
Yeah.
But I said the ketogenic diet is at least you're eating something and you're going to get the same thing as if you were fasting. So and they were doing that
The
ketogenic
same,
diet
what do you mean the same thing as if you were fasting?
because when you eat ketogenic diet, you eat small amounts of it. So your blood sugar goes down and your ketones go up just as if you were doing water only fasting. But
Oh,
people
okay.
don't want to
All right.
do water only fasting because it's hard. It's not easy. Believe me, I tried this. It's not easy.
Yeah.
So, but people can do ketogenic. In fact, we were treating all these little kids in the clinics with epilepsy using ketogenic diets. And, the interesting thing about children, see, in the mice, we can control what the mice eat. They're in separate cages. We can do all this kind of stuff. And when the child has seizures, the parent controls what the child is eating. The parent does not want to see their child have epileptic seizures in front of them.
Sure.
So if the child cheats on what he's eating, they explode into an epileptic seizure. So apparently the parents are very rigid, almost like we're rigid on the mice in the cages. The parents are rigid on their children with epilepsy and maintaining low sugar and elevated ketones to prevent the seizures from happening. But, you go to an adult, he doesn't want to do that. He'll prefer to take the pill or take something else. But in any event, so we started moving more and more into cancer with restricted diets and this kind of stuff because it was so powerful. It was unbelievable. And we mapped out the mechanisms by which all this is working, shutting down inflammation, increasing programmed cell death, angiogenesis that I got the big grant from. All the blood vessels in the tumors were shrinking. So we were linking this
Without the drugs. It's just
without any drugs.
the calorie restriction caused
Yeah. And the other thing, too, is we did some really nice studies on mice and humans. Okay, we were cutting the calories in the mouse down by 40%, meaning that he was getting 60% of what he would normally eat, a 40% restriction.
right.
But because the basal metabolic rate of the mouse is 7 times faster than that of the human, what does the human have? So people said to me, oh, it's easy. I can do 40% calorie restriction. But for a human to get the power of what we saw in the mouse, it's water only fasting. So when humans do water only fasting, their blood markers, cholesterol, triglycerides, glucose, ketone, all these things change the same way as the mouse under a 40% restriction because of the differences in basal metabolic rate. So now you're back to water only fasting again in
Yeah.
humans, and they don't want that. So we
Well,
built.
you can't live very long that way.
No, you can't. And that's why Wilder in 1921 developed the ketogenic diet for children with epilepsy because water only fasting only worked for so long. So I said, why don't we do the same thing with the tumor? Why don't we try to work in a calorie restricted ketogenic diet, which will keep the pressure on the tumor, shrink it down, do all the wonderful things, but the mouse doesn't have to starve to death. So we did that. And as we were working and developing all this, there was an interesting study came out of Case Western Reserve by Linda Nebling, where she got her PhD in nursing from Case Western, and she was working in a pediatric neuro-oncology group, and she had several little kids with these inoperable, they were considered hopeless brain cancers. They were high-grade gliomas, and she convinced the neuro-oncologist, the pediatric oncologist, to let her try a ketogenic diet on these kids with brain cancer. So they said, yeah, what the hell? These kids are hopeless anyway. They've been surgically mutilated. They were radiated. They were poisoned, and they weren't responding. One was a couple, 3 years old. The other one was like 6 years old. Can't remember. She published it in one of the nursing journals. I grabbed it. I said, wow, that's really interesting. And she said in that paper, ketogenic diet, and those kids responded. One was so brain damaged from the treatment, but they went to special education. The other one recovered quite well, was lost to follow-up. So we don't really know if parents moved away or something. But it was really remarkable how powerful this was on these little kids with brain cancer. I said, wow. I said, well, why don't we try that in the mice? And and then she said in there, this works because Otto Warburg said a long time ago, tumors need sugar. And so I said, who the hell is Warburg? I said, yeah, I said, so I always heard of Warburg.
Back to Warburg, doesn't it?
Yeah, so I always heard of Warburg, but I never knew what he really did. So then I got his original papers, had some of them translated into English, found them all over the place. So I'm looking at Warburg and I'm reading his papers and I'm going, God damn, I'm seeing the same thing he saw. Everything is the same with respect to the power of what we're seeing. But he said cancers start from damage to oxidative phosphorylation, which is the ability of our cells to get energy using oxygen. And it has to be a chronic damage. It cannot be acute damage because acute damage would kill the cell, it would stop energy, the cell would die. So step one was a chronic disruption of oxidative phosphorylation coupled to a compensatory substrate level phosphor, which is fermentation. He called it aerobic glycolysis, which is aerobic fermentation. And he said all cancers have this same problem. I said, wow. And then, he published a lot of his work. He was a very rigid biochemist. He has a fascinating story, too. Hitler survived. He was half Jewish, and Hitler knew that he was the only guy in the world that actually understood cancer better than anyone else. So they spared him. They didn't send him to the chambers, the gas chambers. He was an arrogant German aristocratic guy. He didn't like Hitler. But they allowed him to continue to do his own work. As long as he had his work to do, they left him alone. And Hitler knew that if anybody was going to cure cancer, it was going to be Otto Warburg. So I looked at his work. I'm seeing the same thing in my mouse and in the mice responding. And I said, then I started to look at the structure and function of mitochondria, which is what he said was the origin of cancer. And we did some deep studies on lipid biochemistry, now going back to my lipid knowledge, my lipid and brute force biochemistry. So we pulled mitochondria out of these cancer cells and compared them with mitochondria from the normal brains, brain tumors versus normal brain. And one of the key lipids in mitochondria is called cardiolipin. It's a lipid in the inner membrane of the mitochondria, and it's absolutely essential for the effective oxidative phosphorylation. Cardiolipin was damaged in all the tumors. It was abnormal in number. The structure of the lipid was abnormal. Therefore, I know those tumor cells can't do oxidative phosphorylation, and they were fermenting like crazy. They were throwing out lactic acid, and just like Warburg said. So I said, why that? How is it possible that nobody followed up on Warburg? Because Warburg had it all right, except for a few things that were problematic, and I fixed those things up. It turned out everybody ran off chasing genes. They said they threw Warburg under the bus, and they said, oh, these cancer cells can take in oxygen, some of them just as well as normal cells, therefore Warburg must be wrong. So I went back and I showed, listen, no, that's not true. We found that cancer cells take in oxygen. They don't use it for energy. They use it for other things, reactive oxygen species, ROS, and it's the ROS causing the mutations in the nucleus. So the mutations are all downstream effects, yet the whole field of cancer is focusing on downstream effects caused by the damage to the respiration in the mitochondria. Can you believe this? So we have a multi-billion-dollar industry chasing effects as the result of people looking at the wrong thing. That's why we have 1,700 people a day dying from cancer. As long as the theory under which you're studying the disease is not correct, you're not going to have any meaningful impact in treating patients with cancer. And this is what we're seeing. So we went back and figured out where Warburg made his mistakes. He made two mistakes. He quantified lactic acid as a form of energy from ATP in the cytoplasm. And he also said cancer cells don't take in as much oxygen as normal cells, and therefore they have a defect in oxidative phosphorylation. He was using quantitative measures that we have now shown to be inaccurate. We now know why Warburg made his mistake. We know all of the controversy that was associated with Warburg studies and why there was not only scientific evidence, but personal evidence. People didn't like him because he survived the Holocaust, and people were angry about that. Can you believe this? So there was a lot of personalities. There was a lot of problems. I could care less about all that. I was looking for the truth. I was looking for what is going on with these cancer cells. So I found in my studies that all cancers have abnormalities in the number, structure, and function of mitochondria, whether it's in the lipids, the proteins, the DNA, or whatever. But not all cancer cells have defects in the mitochondrial DNA. We proved that. We actually corrected the genome database on mouse DNA from looking at, we had 5 mouse tumors, not one had a mutation in the DNA, pathologic mutation in the DNA. So we ruled that out. So then we had cardiolipin. No cancer has ever been found with a normal content of cardiolipin. No tumor can respire effectively. Therefore, in order for it to survive, it must ferment. Then we said, what is it fermenting? It's fermenting the sugar glucose. And our big discovery was it also ferments an amino acid, glutamine. Most people know glutamine to be used by cancer cells, but they thought it was respired. No, it's fermented in the mitochondria. It's actually fermented in the very abnormal structure of the organelle. So that's one of our big discoveries here. So it puts the center of the cancer problem back on the right track after all these years. We now know cancers cannot burn fatty acids or ketone bodies because their mitochondria is defective. You need a good mitochondria to get energy from fatty acids and ketones. So we know that they can't use that. They need fermentation. They need glucose and they need glutamine, and they can't use ketone bodies or fatty acids. Wow. We know how to manage cancer. Not a problem. Lower the glucose and the glutamine and put the patient in the high ketosis, and then you come in with drugs to target the glutamine. Now, this will be the standard of care for the future. No question about it. This is going to be the standard of care. Why? Because it's based on the hard science of Warburg and our work and others. So we know that. And we haven't found the cancer cell that can survive without glucose and glutamine. It tells us
This is not just brain cancers or particular kinds of brain cancers. This is every kind of cancer you've tested.
Every cancer. They're all the same. I went through and there's one disease. It's a disease of energy metabolism. And they need those two fuels, and they can't burn fatty acids or ketones. Okay, the cancer cells have been telling us for decades what's wrong with them. The cancer cells, the disease itself has told us we can't get energy from oxygen. We have to ferment. What do you ferment? We only find two. We interrogated these cancers. We put them under, we take everything away from them and see how fast they starve to death, just dying in vitro. Then we add things back one at a time. Add this amino acid, that amino acid, this sugar, that sugar, this amino acid. And all of a sudden we find out exactly what they need. They need the sugar, glucose, and the amino acid, glutamine. Everything else pales compared to those two things. And then when you look at the human body, glutamine is the highest amino acid naturally in our bodies. It's the number one amino acid in our bloodstream. It's used for the gut. It's used for the immune system. It's used for the urea cycle. It has a very powerful role in our body. And sugar. Okay, we're always, we have a high blood sugar level and all this kind of stuff. So clearly the two fuels that are driving the beast are present already in our body in abundant quantities. So you look around and say, okay, are there any clinics anywhere in the world that are simultaneously targeting glucose and glutamine while putting the body in nutritional ketosis? And the answer is none. Nowhere. Nowhere in the world are they doing what I just said we should do. Why? Why would they not do that? Because they think cancer is a genetic disease. So they keep building immunotherapies, CAR T immunotherapy, all these kinds of things that are based on the somatic mutation theory, which says that all cancer dysregulated growth is caused by mutations, right? I already told you the mutations are a downstream effect of the reactive oxygen species produced from the defective mitochondria, okay? So we know that's all downstream stuff.
And just to be clear, the mitochondria are damaged. It's chronic damage, not acute damage.
Yes.
And what are some of the sources of the chronic damage?
Okay, so that could be exposure to chemical carcinogens. It could be to intermittent hypoxia. It could be to chronic inflammation.
Whoa. Intermittent hypoxia?
Yeah.
Not breathing well at night?
Yes.
Could actually directly lead to cancer.
It could, yeah, because Warburg clearly showed. And this is one of the things I was shocked about, because Warburg said, in fact, in all of his papers, he said, if you give cells a lot of oxygen and put them in oxygen hypoxia, you damage the mitochondria. You damage the mitochondria. Okay. So I went to a dental meeting one time, and they had a new device to stop sleep apnea. And I was watching this kid, and he didn't breathe for about 30 minutes, not about 30 seconds. About 30 seconds, he was not breathing. And then all of a sudden, and he did this during the course of the night. And I go, oh my God. I said, this could be, and if you're obese and you have high blood sugar and you have no exercise and you have sleep apnea, you could put yourself at risk for all kinds of cancers. So obesity is linked to systemic inflammation. Systemic inflammation damages oxidative phosphorylation. hepatitis viruses, papilloma viruses damage oxidative phosphorylation, chemical carcinogens damage. Why everybody fears radiation? Radiation can lead to cancer. Why? It damages oxidative phosphorylation. Age, the older you get, the more opportunities your mitochondria in some cell and some tissue has the opportunity to get damaged. I went through, it was called the oncogenic paradox. And that was put out by Albert St. Georgi, who won the Nobel Prize for his work on vitamin C. He did some work on cancer. He says, geez, you can't, almost everything in the environment could cause cancer. He said, but what is the common pathophysiological mechanism for all these different desperate linkages to cancer? What is the common pathophysiological mechanism? And it's chronic damage to oxidative phosphorylation coupled with a substrate level 5, which is fermentation. That's it. We know exactly what causes cancer. We know exactly why they're growing out of control, because the organelle that controls the destiny of the cell is the mitochondrion. It controls the cell cycle. It controls the differentiated state. It controls when cells should grow and how long they should grow. When that organelle becomes corrupted, these cancer cells fall back on ancient fermentation pathways that existed for all organisms before oxygen came into the atmosphere 2.5 billion years ago. So we know exactly what's going on with these cancer cells. They're falling back on heirloom pathways as the predominant way to get energy, ATP. How you stop that? You got to pull the plug on their fermentation and transition over to fuel they can't use. It's almost, I hate to say it, it's embarrassingly simple. Yet people make it out to be the most complicated disease. Look what they're doing to cancer patients. They're poisoning and irradiating them and surgically mutilating them. Once you understand what cancer is and how it starts, you can put all the pieces of the puzzle together. And then when you publish these papers, you might as well be talking to the plug socket on the wall over there. They can't understand. They understand, but they can't. Actually, they can't do anything. They're trapped in the system. The system traps them. They're getting big grants from the National Cancer Institute to study these genes and these mutations. So their careers and their livelihood is depending on them doing exactly what everybody else does. And when you say, what is cancer? Oh, it's a genetic disease. Did you see the evidence that it can't be? We have tumors that have no mutations. How you explain that? Then we have all these driver gene mutations, which are supposed to be the ones that drive the dysregulated growth. They're loaded in normal tissues of our body. Can you believe it? And then we have the nuclear mitochondrial transfer experiments. You put that together, as I said, you have to be a hopeless ideologue to think that cancer is a genetic disease. It's not. It's not. But the system is trapped in this. The pharmaceutical companies, the hospitals, everybody's making millions and millions of dollars treating cancer with horrific medieval practices when you don't have to do that. This is the great tragedy that we're dealing with right now. You can go down to any major clinic and even ask these oncologists, do you know cancer can't live without fermentation? Never heard of it. Do you know anything about what drives their dysregulated growth? Some gene mutation. What about where they're getting their energy from? I don't know. So the whole field is trapped in a silo of groupthink. And as long as they keep pushing this crap, these immunotherapies, they tell you more how they're going to kill you rather than how they're going to cure you, right? You see the advertisements on television.
Oh, God, yes.
Yeah, right. They're going to kill you, these things. And then sometimes they cause hyper-progressive disease where the drug kills you faster than the cancer.
You said toxins, toxic chemicals could be the source of the chronic damage. Could the pharmaceuticals be a vector that the chronic damage occurs from?
Yeah, because we know that, mustard gas and these toxins they cause mutations. They cause damage to oxidative phosphorylation. They're the same drugs they use to try to treat the cancer. So many of the drugs used to treat cancer themselves are toxin. They damage the mitochondria, right? It's unbelievable. You just happen to kill cancer cells along with a lot of normal cells.
Along with everything else,
You kill, your hair falls out. Well, I always look at poor bald-headed, when I look at these companies or these foundations or whatever they are, you always see the poor little bald-headed kid, the woman with some turban on her head or the guy with some hat to cover up the baldness. I said, why are they bald? You're trying to kill a cancer cell in the guy's liver or lung or breast or colon. Why is he bald? Oh, the drug. You don't know anything. Every time you see a bald-headed person, that person was treated by somebody who has no clue what the hell they're doing. They only know how to give you enough poison so you don't kill the person.
Right.
They're not knowing that that makes no sense. The tumor cell can't live without glucose and glutamine. It can't burn fatty acids and ketones. Do you know that? No, I never heard of that. Well, look at all the literature that I published. Look at all the evidence that I showed. What number do you not believe? What evidence do you not believe?
We've had enough folks on this show and on Dr. Avadia's show that I understand that when you reduce your carbohydrate intake, you starve your system of glucose, the body naturally kicks over into burning fat to get you into a state of therapeutic ketosis. So that part, as I understand it, will starve these cancer cells of glucose. Am I right so far?
Yes.
But the glutamine, which occurs naturally in our body, how do you address that as a source of fuel for the cancer
Yeah,
cells?
that's where we have to be strategic on that. So we can't go into it like a bull in a china shop. That's why I wrote the press pulse therapeutic strategy for managing cancer. You can chronically press glucose. You can chronically press the level of, we don't need glucose. We can burn fatty acids or ketone bodies. We only need a tiny amount of glucose in our bodies for the red blood cells, which have no mitochondria nucleus. They're completely dependent on fermentation, but they use so tiny amounts to do what they do. We don't need very much glucose at all on that. So that's that, and we evolved to be mostly in nutritional ketosis anyway. We didn't have delicatessens on every corner, as my friend Veach would say. We had to track down and kill animals and eat them. A lot of energy,
Yeah.
activity. Carbohydrates were seasonal, maybe from ripe fruit or something like this.
Right.
Now getting back to the glutamine issue. And everybody says, oh, what can I eat to reduce glutamine? No, you can't do that. You have to use drugs. And we're learning that one of the best drugs was 6-deoxynorlucine, DON, D-O-N. It was an antibiotic found in streptococcus kind of bacteria. And it was used in the clinic years ago for cancer, but it wasn't used correctly. They didn't target glucose at the same time, and they were chronically using DON, which makes your immune system, you got to keep your immune system strong, and you got to not damage your gut. Everybody they're all you're always talking about this microbiome, And I'm saying to myself, but if you're a cancer patient, you're on the toilet all day long. Nobody seems to care about your microbiome when you're a cancer patient. You're nauseated, you have diarrhea, fatigue, all this kind of stuff. You're blowing the hell out of your microbiome with radiation and chemo. If it's so damn important, why the hell are you using drugs that are going to blow the hell out of your microbiome?
Yeah.
So we have to be very strategic in how we target glutamine, because the gut needs glutamine. The immune system needs glutamine. Some of our urea cycles and metabolic cycling pathways, they need glutamine in one way or another. So we pulse then. So we come in just with a dose of targeting while the patient is being while the tumor is being choked to death on its glucose availability. You come in and you pulse with short doses of glutamine targeting drugs like DON. And we even found some of these parasite medications are good to do this as well. But it's a plan. It's a strategy. And the patient has to be in nutritional ketosis. So they are responsible. The patient themselves play an enormously important role in managing this disease, because we've developed the glucose ketone index calculator to allow everybody to take a drop of blood from your fingertip and measure your blood sugar, and take another strip and measure your blood ketones. And the ketone meter, you push the button, glucose ketone index ratio. If you can keep it at 2.0 or below, you're choking these damn tumor cells to death once you know that. But they're surviving because they have access to the high levels of glutamine in your bloodstream. So then you got to come in strategically with these glutamine targeting drugs, just enough to kill the tumor, but not to damage your gut or your immune system. So your body, and exercise, we found out that exercise will lower glutamine. So while you're going through this whole process, you're in the gym working out, you're walking around the block, you're doing all this kind of stuff.
Exercise lowers glutamine.
Yes. My friend George Cahill down here at Joslin Diabetes Center, one of the leaders in the field, he published a paper showing that vigorous exercise will lower glutamine, but it's not lowering enough to kill tumor cells. However, if you exercise, you're bringing it down. You come in with very low doses of glutamine targeting drugs, just periodically, and you'll just decimate these tumor cells. Now, it works really well when the person is first diagnosed with cancer. But sometimes they come to me and they're just like walking dead men. They're all emaciated. Their whole bodies are beat to hell from what they've done to this poor soul. And then they say, oh, can I do metabolic therapy now? And the answer is sometimes it works. A lot of times it doesn't. Your body has to rally. It's very interesting, Jack. When you put your body under this nutritional stress, the body has an internal surveillance system, and they start to say every cell and every tissue, every organ that we have better account for its existence. You have to work maximally efficiency because the energy is no longer coming into the system. So you have the process of autophagy, where the cell itself digests part of the malfunctioning mitochondria and rebuilds the mitochondria into a super strong organelle. So that's autophagy. The body is now, and then we have autolytic cannibalism. This is where you have a tumor that you have a lot of edema and dead cells. The body attacks that when you're under nutritional stress and uses the tumor cells to fuel food for the rest of the body. So all based on evolutionary concepts. I understand this because I understand evolutionary, but without an understanding of evolutionary biology, we might as well still be in the Stone Age. Stone Age mentality ain't going to help us. You got to understand biology from the beginning to the end. You have to put in all the parts of the puzzle, and then you know how to kill these cancer cells without toxicity.
Yeah, let's look at both those who want to prevent and those who would like to recover from the number one and number two killer of Americans today. What do they do?
When you're talking about prevention, as I've written in my book, and I wrote only one book, by the way, I'm being pirated on the web by all these, summaries of my book and all this, using my name. Can you believe this? They're using my name, putting on books I never wrote. Anyway, prevention. It's very hard to get cancer if you have good, healthy mitochondria. You have to keep your mitochondria healthy, okay? And how would you damage your mitochondria? Get a lot of systemic inflammation, eat a lot of highly processed carbs, don't exercise, sit in front of the TV, have a lot of stress, have no friends, bad food, all these kinds of things all put together, and you can probably get your mitochondria damaged enough to get cancer. And that's what we're doing. That's exactly what we're doing. We're doing all that. So we're seeing so much more cancer coming now in young people. I can't tell you how many emails I'm getting from kids in their late 20s and mid 30s, early 40s. They're coming down with all these horrific cancers. And I'm saying, what the hell are you people doing to yourselves out there? So whatever it is, they're damaging their mitochondria in one way or another. And people always say to me, if that's the case, how come little babies and little kids get cancer? And there's a lot of developmental anomalies that can lead to damage to oxidative phosphorylation in the brains or tissues of young people as well. So we know we've never seen a cancer not ferment. So we know that the only way it did that is damage to oxidative phosphorylation. Now, our ancestors, cancer was unknown in tribes that exist according to their standard ways, like the Sand people from Africa and all these people. They have tremendous exercise. They're eating all organic, natural things. What killed our ancestors during the Paleolithic times, like several 100,000 years ago, was infections and injuries. They had no antibiotics or no orthopedic surgeons to help their broken bones and all the things that we can take care of. So what killed them was infections and injuries, and that's what kills wild animals, infections and injuries, wolves and things like that. Not cancer, type 2 diabetes, dementia, all that kind of stuff. That's the success of our technology, food technology. We are now we're still Paleolithic biology in modern society. Our biology has not evolved as fast as our technology has. Everything is convenient, sweet, no exercise, doing all this stuff. We damage our mitochondria. We get fat. We get demented. We get cancer. We get diabetes. We get macular degeneration. We get cardiovascular disease, all related to the same thing. So we put ourselves at risk. So if you can use exercise and nutritional ketosis and skip a few meals and do all this keep your mitochondria healthy. And then, of course, if you are unfortunate enough to get cancer, then you come in with metabolic therapy, which is actually bringing us back into a state of nutritional ketosis, but now using drugs and procedures to target the glutamine availability of the cancer. So
how long does the glutamine targeting treatment What's the duration of this?
That's where we're cutting edge right now. We don't know. Some people respond really fast, other people, and some people never get over it. They always have the cancer. It's always there. It's just not growing anymore, or it's indolent. It grows like unfortunately, we lost our poster child for glioblastoma, Pablo Kelly. He survived 10 years with a glioblastoma. And we were talking to him in August, healthy as hell, doing really well. He went in for an elective surgery to remove a small piece of tumor that he had in his brain, and he died from cerebral hemorrhage. He didn't die from the cancer. I said to Pablo, when I was talking to him, I said, you're a GBM survivor for 10 years. You're perfectly healthy. The tumor's never been gone, but it's always there. So every few years he had it cut out. And I said, you might live longer than me. And we were both laughing about that. And the next thing you know, I got a message that he had a cerebral hemorrhage. And he even sent us a picture coming out of the emergency room with a bandage on his head, with his thumbs up. And he was talking to his wife, who was very excited about everything. And within 8 hours later, he had a cerebral hemorrhage and died. It wasn't, but he was a 10-year survivor of glioblastoma with no radiation, no chemo, no steroids, none of that. He just did metabolic therapy. Would it work on others? I don't know, but we certainly know how we would strategize. I published a paper showing that the reason why most glioblastoma patients die is because of the treatment. They get radiation. You should never treat the damn brain with radiation. What the hell is wrong with these people? We showed that when you treat the human brain with radiation, it frees up massive amounts of glutamine in the microenvironment. The radiation makes your blood sugar go through the roof, and then they give you steroids to lower the edema from your head swelling from the radiation, and that puts you into high blood sugar. So the two fuels driving the beast are made massively available by the very treatments that you're using. And when you look at the survival for glioblastoma, oh, it's terrible. Everybody says, oh, you're dead. Yeah. We haven't made an advance in survival in glioblastoma in 100 years. And everybody, when you look at the survival curves, they're replicable across countries, across hospitals, across everything. And everybody says, oh, it's a very deadly. Yeah, because you do the same stupid thing to these people day in and day out. You don't get anything different. Every now and then you get a survivor who lives a little bit longer. And then I talk to these guys, these radiation oncologists. I said, when are you going to stop irradiating the brain? Oh, no, we can't stop that. That's part of the standard of care. Don't you know that? And I'm saying, you guys got to get your act together here, because you're part of the problem, not part of the solution. I don't care how much money you make, all this money radiating poor people, and you wonder why they're dying like this. Give me a break. And then when you talk to them about what I just said about the metabolic, they have no clue, never heard of it. They're not trained to think like this. So I feel bad for them, and I feel bad for the patients, because neither the patient nor the caregiver have any clue about what they're doing. So yeah, some people do survive, but it's not. So what they do in the clinical trials is that, okay, we'll do ketogenic diet for ketogenic metabolic therapy for brain cancer after their brains are irradiated and the tumor comes back, recurrence. So now they know you're finished. You're a dead man walking. So now we might consider doing ketogenic metabolic therapy. And as a matter of fact, these people do live a little bit longer, even after they've been brutalized by the system. So this is why I'm saying a lot of medical stuff in cancer today is medieval. It's absolutely medieval. You shouldn't be doing this. And I think as time goes by, we're going to look back and say, how dumb were we to absolutely ignore the biology of what the cells are screaming at us to tell us what their metabolic problem is. They're telling us how you can kill them and get rid of them. And we have chosen to ignore the very information that the cancer cells have been telling us. Can you believe this?
Well, that's the human condition. When your model of whatever reality you're looking at excludes the existence of something, you can't see it, even if it's there. You've got to have a different model. And I guess the blessing from your standpoint is that you didn't come into the field with the purpose of studying cancer. You came at it from a completely different angle, kind of got there sideways, and weren't blinded by those preconceived models of what cancer actually is or how it works.
Yeah, I guess you can say that for sure. Although I have to be honest with you, when I was in going through genetics at Illinois State and University of Illinois, I mean, when we got to the section on cancer, we would study all these oncogenes and tumor suppressor genes and all these kinds of things, just because everybody else studied them. And I would
Sure.
just, you'd take a test, you memorize all this stuff, you regurgitate it on the test, only because everybody else was doing it. What
Yeah.
led me to the new knowledge was my own research, questioning the very stuff. This stuff doesn't make any sense. But we do know that the oncogenes, which are considered facilitator, what the oncogene does, and you have a number of them. It's interesting when the mitochondria become defective. It's very interesting. This organelle is so incredible. When it becomes chronically defective, it sends signals out to the cell nucleus to say that we're suffering, we're suffocating, we're not getting enough energy. So we have to upregulate fermentation. So what it does, the mitochondria sends an incredible, it's called mitochondrial stress response or retrograde signaling. The mitochondria sends a signal to the nucleus of the cell, and the nucleus immediately turns on oncogenes. And these oncogenes open the floodgates for glucose and glutamine to come into the cell. So the mitochondria tells the nucleus, I'm suffocating. We need to ferment if we're going to live. So the oncogenes turn on the transporters for glucose and glutamine to get into the cell to facilitate the transition to fermentation. In the meantime, the mitochondria get more and more damaged to the point where they lose control of the cell. Now the cell is completely locked into this ancient fermentation pathway. And as long as it has the fermentable fuels, it continues to grow. And then they argue, and the fermentable fuels acidify the cancer microenvironment. They throw out waste products. The waste products of glucose is lactic acid, and the waste product of glutamine fermentation is succinic acid. All right, these are two acids. And what it does is acidifies the microenvironment of the tumor. So when you come in with radiation and chemo and immunotherapies, they say, the cancer cells are too hard to kill because the microenvironment is so acidified, it's protecting the cancers. Give me a break. The acidification is coming from the fermentation. Take away the two fermentable fuels. You won't get the acidification goes away. So it's everything makes total sense metabolically and biologically and biochemically when you realize that this is a mitochondrial metabolic disorder. It's not a genetic disorder. And the gene mutations are all downstream epiphenomena about this. So
is there any way to check yourself to see what your biochemical state is in relationship to kicking over into this fermentation state? Is there anything that before you end up with a cancer diagnosis?
As I said, when you have when your C-reactive protein in your bloodstream is high, which is CRP, this is a marker for systemic inflammation. So you're there, and you can see how close or out of healthy range your blood markers are. So when my colleagues see cancer patients, the first thing we do is a hugely comprehensive blood analysis. And we see, wow, this guy is really out of whack. His markers are far from healthy. So you have to bring that person back into a healthy zone, and then you move them through. So when you say, how do I know I'm fermenting? A lot of people, if you have type 2 diabetes, you have obesity, you have a lot of different things, your mitochondria in your body are going to be under some sort of stress.
It sounds like what we see as separate diseases, cancer, diabetes, heart disease, obesity, that it sounds like what you're saying is that these are merely different expressions of the same underlying problem. Am I oversimplifying here?
No, you're spot on.
So these things that are on the top of the list of things that kill Americans, they're not different things. They're different
Some
expressions
people,
of the same
yeah,
thing.
yeah, because obesity is now linked to cancer, but oftentimes through type 2 diabetes. So you have diabetes, you have obesity, but you look at your inflammation could manifest itself by cardiovascular disease, macular degeneration, dementia. All of these are diseases of a disrupted energy metabolism coming largely from our diet and lifestyle. So,
Whoa, stop right there. Okay, folks, let's highlight that. We listed diabetes, obesity, dementia, cardiovascular disease, cancer as largely the result of they're all metabolic dysfunction, or they are all different expressions of the same underlying metabolic dysfunction, which is essentially what we eat and
what
how
we do.
what we do. Okay, this gets back to the predictive part of all of this. Let's talk about just I'm just going to cut to the chase. I like to ask at the end of an interview this question. If you had only one message to deliver to help people recover or prevent whatever this disease, this situation is, and you had no more than 8 words to deliver it, what would those 8 words be?
Move more and eat less. But let me tell you, Jack, it sounds simple, but man, is it a hard thing to do in our modern day and lifestyle. You can't, it's very hard to do that. People are sitting in traffic, they're under stress. You're working hard every day in a job, and you come home, you don't have to go out in the backyard and kill a chicken and pick, tomatoes off the plant. It's everything is convenience. And we pay a price for that convenience. And it's all those different chronic diseases. That's why we developed the glucose ketone index calculator, because people who can maintain a low GKI have a real good chance of preventing all of the different chronic diseases linked to our diet and lifestyle. And I built it for the brain cancer patients, but I find that all these young people in the gyms and all this kind of stuff, they're always looking at their GKI now and saying, geez, if I keep that low enough, I can possibly reduce the risk for having all these. But of course, when you're young and you're not married and you're just playing around, it's okay. But when you get a family together and you're trying to eke out an existence, a lot of what I'm saying becomes much more difficult in a modern society than it was during our Paleolithic ancestry. So we just have to know. We just have to know about it. I would say one of the things I do here at Boston College is I teach biology and cancer biology, but I also teach scientific literacy. It's important for you, as you know, from our past experience with the COVID and with everything else, we are almost a complete scientifically illiterate nation. We have no clue about any of our what makes us work, how we think our bodies are working. Scientific literacy is important in a society driven by scientific technology and these issues. So it's important to understand this, and people need to. It's on our shoulders. We're the ones that need to know about this, and people rely on the internet and eat this weird thing, do that, do this. You have to always ask, what is it going to do to my glucose ketone index? If it lowers my glucose ketone index, then it might be okay. If it doesn't lower the GKI, what the hell are you doing that for?
I like that. That's simple and straightforward.
Yeah,
All right.
but then when they say, it's very hard to get into the low GKI. Yes, it is. I'm not saying it's easy.
Yeah. But the folks who tend to follow these kinds of things are very familiar with intermittent fasting and with low carb, high fat diets. I wanted to make sure I ask you about this. You also talked about calorie restrictions. One of the things that a lot of folks who are eating a low carb, high fat diet will do is completely ignore the amount of calories, mostly because it's pretty hard to overeat getting if you're not getting carbohydrates. It's hard to overeat protein and fat.
Yeah,
Talk about that real quickly, if you don't.
No, I think that's your going back to your more Paleolithic. What did our Paleolithic ancestors eat? Don't forget, we're a species about 1.5 million years of our existence as a human species. And now we're in a modern society where all these diseases have sprung upon us within the last 75 years, 100 years, recent history of our existence on the planet. But what were our ancestors doing? And they were tracking down and killing animals, and they would have to run them down for hours and hours. And that's a tremendous amount of energy that was used in that time period. And what were they eating? They were eating meat, and they would eat tubers, and they would eat berries and whatever they could get their hands on. And that kind of diet and lifestyle, they were, as I told you earlier, they weren't dying from chronic diseases. They were dying from injuries and infections. But now we're dying from chronic diseases, and we've taken care of the injuries and infections with antibiotics and orthopedics. So we're the same. Don't forget, we are Paleolithic man in a modern industrialized society. where everything is convenience, and we're creating all of these chronic diseases ourselves. So it's not, and you have to look at our genetics. We evolved to go long distances, walking, collecting with minimal food. So our biology says we can go long periods without eating, just drinking water. And we would store as much energy as we possibly could when we had meals. We're kind of a scavenger species. You just gorge yourself on whatever kill you would have and store as much energy as you possibly could. Now you take that same biology and you put it in 2024, where you got fast foods on every corner, you've got donut shops, you've got everything. And we're a biology that stores energy. So the obesity epidemic is evolution in action. When people say, I don't understand biological evolution, I don't believe in biological evolution. Do you believe in the obesity epidemic? Do you see the obesity epidemic? That is biological evolution in action. People that are obese today are the ancestors of those members of our species that existed 150,000, 200,000 years ago. So those our ancestors were those guys. They are the descendants, I should say.
Yeah.
The obese people are the descendants of members of our species that survived the most horrific calorie-restricted days of our existence. So they are the descendants of super energy efficient people, just put in now into a new environment. And now you see obesity. That's evolution in action.
I knew this was going to be fun. I love how I'll confess your mastery of all these chemical terms amazes, surprises, and stumps me a little bit. But by and large, I think I got it. Cancer is caused by chronic abuse of our cells, of the mitochondria. The mitochondria get damaged. The damage results in them being unable to metabolize glucose. Therefore, they start fermenting.
They ferment glucose. They ferment the glucose.
They ferment the glucose rather
Yeah.
than go through the normal.
They don't use respiration. They use fermentation. So that's the other thing.
Because of this oxidative phospho.
Yeah, that's what breathe. Well, you're breathing on breathe. Well, the oxygen that we come in drives the energy in our body. Okay. And cancer cells don't use that. That's the other thing too. If you take cyanide, you die quick. That was Jonestown, right? They drank the Kool-Aid with the cyanide Kool-Aid. Everybody was dead real quick. Cancer cells can live in cyanide. They don't use oxygen. So that's another, Warburg found that and some others found that. So cancer cells don't die from cyanide. So they don't die from hypoxia. They don't die from cyanide.
But hypoxia is one of the things that can damage. Wow.
Yeah. So we know pretty much what we need to do to prevent cancer. We know pretty much what we need to do to treat it when it happens. The problem is most of the world doesn't understand it, doesn't want to understand it.
And there's a whole lot of money in not understanding.
And remember, there's a couple of cells in our body that rarely, if ever, get cancer. And that's cardiac myocytes and neurons of the brain. You know why they can't get cancer? Because
this question has come up before, but I don't remember the answer.
They can't ferment. They can't live on a fermentation metabolism. They die. So when you disrupt their mitochondria, those cells die, and you can never get a cancer cell from a dead cell. Only cells that can protracted upregulation of fermentation can become cancer cells. So neurons in the brain and cardiac myocytes rarely, if ever, become cancer. In the brain, we have glial cells that they can ferment, but not neurons for very long. Neurons can ferment over a short distance. But our cardiac myocytes, the heart pumping, you need oxidative energy all the time for those cells. They cannot stop doing that and ferment and get the same level of pumping. You don't do that. It's again, you got to know the biology of all the organ systems, how they play off of each other, how we are one integrated whole. We're not a liver and a kidney and a brain by itself. We're a complete integrated machine. And that machine depends on energy. And that energy dictates the health and vitality of the cells and organs in our body. And that's what keeps us alive. And that's all run by the mitochondria. And the nucleus just follows the orders of the mitochondria, turns on, turns off genes. So it's really our energy system that's really running the show.
It's our energy system. So I think the takeaway for me is all the early warning signals of diabetes, of obesity, of Alzheimer's, of cancer, they're all the same thing. It's
They're not exactly the
elevated
same thing.
elevated levels of blood sugar,
Yeah.
elevated inflammation. Those things can all result in those things, which I guess another way to say it is we can manage all of that the same way.
That's true.
It may express itself down the line through cancer in one person and heart disease in another, but the front end of that process is always elevated blood sugar, inflammation. I'm assuming insulin resistance.
Yeah. Yeah. It's all related to the same metabolic. It's in homeostasis. We're out of metabolic alignment. When we're in metabolic homeostasis is when all of our systems are working in a healthy way.
It sounds like another way to say it is healthy people don't get cancer.
That's kind of a mostly that's true, but not because people ask me, oh, this guy was working out in the gym. He always was eating everything and how did he get cancer? He looks like the healthiest guy. But I didn't know what his glucose ketone index was.
That's my point. It depends on how you measure health.
Yeah,
but if the inflammation in your body is low, you're not overwhelming your system with carbohydrates.
Stress, as I said, that you have to have a lot of things together to create damage to your mitochondria. We're talking about no exercise. We're talking about a lot of emotional stress. We're talking about consuming large amounts of highly processed foods, whether it's carbohydrates or the other things. We have poor sleep. You put all that together and it creates stress. And that stress can damage oxidative phosphorylation, leading to heart disease, cancer, diabetes, all these things, obesity. You put it all together and it comes out. You're right. There's a commonality here. And as I said, we're still Paleolithic man in a modern technological food society. Our food technology and science, everything is convenience, minimal exercise, all this kind of stuff. And you put yourself at risk for all these different chronic diseases.
Dr. Thomas Seyfried, thank you so much. I have really been looking forward to this. We went way longer, folks. I know we went way longer than we normally do. I thought it was 100% worth it. Dr. Seyfried will make sure that all the ways that people can learn more are available in the show notes. But is there one place in particular that you would send folks online?
Yeah, when they want to look, you can't ferret out all the mechanisms that I've spoke to you about today, but I've published these papers open access. My press pulse therapy paper is out there. Our cancer and dog paper is out there. All of the different things are cancer. I challenge the field to look at cancer as a metabolic disease rather than a genetic disease. All of these papers are out there. And don't always forget that our research here is driven by philanthropy and private foundations. We're very grateful for those folks that donate to our research through Boston College or through Travis's Foundation for Cancer Metabolic Therapies. That keeps us going because we're going to eventually crack this cancer. We already cracked it. We just have to show dosage timing and scheduling. It will become the new standard of care once people realize that it's not a genetic disease. It's just a matter of time. There's no question. Because bottom line, people want to live. Sure. And they want to feel good about things. So, so anyway, so my book, I've only written one book, Cancer is a Metabolic Disease, John Wiley Press, not those notes and those reviews that put my name on it as if I wrote it. I did not do that. And then I've had some people call me and say, you can't be a professor writing rubbish like this. And I said, I didn't write it.
Understood.
Yeah. So anyway, we enjoy what we do because we're on the right path and we know it's going to be the big change. It's just a matter of time.
Oh, very good. Thanks for joining us. This has been Predictive Health Clinic. Dr. Thomas Seyfried's been our guest, and we'll see you next time.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.